Hello, my name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Welcome to the latest of our webinar series for 2026, part of our Winter-Spring series. If you're new to our group, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers in the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social cause of cancer. To learn more, visit survivornet.ca. This webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides provided in the presentation. We'll add a quick Q&A session at the end, but if you would like, please put your questions into the chat on the GoToWebinar app. It should be on the right side of your screen. This webinar was made possible by grants from AbbVie, Amgen, Astralis, AstraZeneca, Eastside, Bristol Myers Squibb, Janssen, and Merck. It is because of their continued support that we can host the CCSN webinar series, and thank them for their commitment to our educational endeavors. And now I would like to introduce Jean LaMantia is a registered dietitian, cancer survivor, and author of 4 books on the topics of lymphedema, cancer, and intermittent fasting. She is the creator of daily and weekly journals designed to help individuals with lymphedema and lipedema track their diet and self-care practices and better understand how these factors influence their health. Jean is the creator and facilitator of Lymphedema Nutrition School, an online program that supports people living with lymphedema. She also teaches a continuing education course for dietitians and lymphedema therapists focused on advancing education and advocacy for the nutritional management of lymphedema. And so without further ado, I'd like to hand it over to Jean for her talk, Lymphedema After Cancer, what it is, who is at risk, and what you can do about it.
All right, thank you, Trevor, and thank you to the Canadian Cancer Survivor Network and all of the sponsors for making this possible. As Trevor mentioned, I am a registered dietitian, cancer survivor, and I have a private practice where I provide one-on-one virtual nutrition counseling, and I'm also an author. That's one of my books there, The Complete Lymphedema Management and Nutrition Guide, which I co-wrote with a lymphedema therapist. And just up front, this presentation is intended for educational purposes only. It's not medical advice, and it's not a substitute for the skill, knowledge, and experience of a qualified medical professional dealing with the facts, circumstances, symptoms of your particular case. And for the professionals, participation does not grant or imply an expansion of your current scope of practice. You are responsible for practicing within the limits of your profession, licensure, and regulatory standards. So let's get into it. Let's talk about lymphedema, and let's look at some current prevalence rates in Canada. And I want to compare it to some other conditions. And it's interesting that we're having this webinar today because as I'm presenting it, and obviously it's going to be different if you're listening to the replay, this is March, and March is Lymphedema Awareness Month. And we're used to awareness months, Breast Cancer Awareness Month, Prostate Cancer Awareness Month, but let's just look at our awareness of some of these different conditions. So ALS, otherwise known as Lou Gehrig's disease, had the very famous Ice Bucket Challenge, and that was an awareness campaign to fundraise and let people know about ALS. The prevalence in Canada is about 3,000. HIV, the prevalence about 68,000, MS or multiple sclerosis 77,000, Parkinson's 84,000, Alzheimer's 500,000, for a total of all of those 5 conditions of 732,000. And these are the latest stats I could find. There might be, obviously these numbers get updated all the time. And if you think about that list, you probably have heard of all of those different conditions. But when it comes to lymphedema, not that many people have heard of it and are familiar with it. But if we compare the prevalence rates, it's estimated that 1 million Canadians have lymphedema. So it affects more than all of those 5, and I would argue, fairly common, well-known conditions. So if any condition needs an awareness month, I really think it's lymphedema, because it really is suffering from a lack of awareness. And what that leads to, unfortunately, is sometimes a delay in diagnosis and a delay in getting the proper treatment. So I'm glad that Canadian Cancer Survivor Network is helping to advocate for this and spread awareness and education. So let's talk about the lymphatic system. It's fundamentally important to cardiovascular disease, immunity, cancer, and in all likelihood, obesity, 4 of the major challenges of healthcare in the 21st century. And as you can see from this image, the lymphatic system is throughout the body, and there's practically no place in the body where you don't have that. There are 3 main functions of the lymphatic system, and I'll talk about all of these individually, but they are fluid balance, fat absorption, and immune function. So let's talk about fluid balance first. When your heart pumps the blood out and it goes out through the aorta, that aorta branches off into different arteries, and those arteries reduce in size, in diameter, to arterioles. And then those arterioles pass through capillary beds like this. And on the other side of the capillary beds are venules, and venules grow in size and diameter, become veins, and then those veins return the blood to the heart. So it's a big loop. So leaves the heart, goes all through the body, through the capillary beds, back through the veins, to the heart, to the lungs, to the heart, and around again. So it's thought of as a closed system, but it's really not a closed system, because in these capillary beds, a lot of that fluid leaks out. We used to think it was 15% of the blood fluid leaks out here, but now there's something called the revised Starling principle that says, oh, it's actually a lot more than 15%. Well, what happens to that 15% of the blood volume, which is mainly like a plasma? What happens to it? How does it get back into the blood circulation? And the answer to that is through the lymphatic system. And the lymphatic system, if I just go back to this picture here, the lymphatic system is a bunch of open-ended entry points into it. And your lymphatic system will allow that blood fluid that has leaked out to enter, and it takes it all the way up the body, all the way up here to this area here known as the terminus. And then from the fingertips all the way up, and from the head down. So all of the pathways of lymphatic fluid are coming to this area, and this is known as the terminus. So it's this area here in the hollow behind your collarbones or your clavicles, and that's where the subclavian veins, which are the large vessels that carry lymph fluid, then return that lymph fluid to the bloodstream. Because if we just kept leaking out blood plasma through the capillary beds and that wasn't collected and put back in, our blood would just become so thick, and eventually we couldn't move it. So it's very critical. It's a big part of the cardiovascular system. And so this area is called the terminus when we're talking about moving lymphatic fluid. And if you've ever had manual lymphatic drainage, it's a gentle skin stretching technique that a certified lymphedema therapist will do. It starts at the terminus because you always want to clear the drain first, right? And then you move down to the area where the congestion is, and you move back up. It's just like in springtime now, things are starting to thaw, but sometimes, the drain in the road is clogged with leaves. So you have to move that away, and then you might work your way back down the street with your shovel or your stick, clearing a pathway, get to where the puddle is, and then whoosh, you can sort of bring it all back down. It's the same thing with moving the lymphatic fluid. Let's talk about fat absorption now. When you eat your food and you've got fat in that food, let's say you've got salad dressing or mayonnaise or avocado or nuts, or just fat is in the meat or in the dairy, once it gets into the intestines, your body will separate that fat or break it down into its smallest component, which are called fatty acids. And those fatty acids are chains of carbons. And if it's a short chain or medium chain, it can be absorbed directly from the small intestine. But if it's a large chain fatty acid, it has to be absorbed through the lymphatic system. So what that means is if you have some mayonnaise or salad dressing with your lunch, when that fat reaches the intestine, it's broken down into fatty acids. Those fatty acids have to be absorbed through the lymphatics in the intestine, work its way all through here, up the central lymphatics, and get absorbed here in the terminus. And then that fat is in the bloodstream. So it's critical for fat absorption. The third function of the lymphatic system is the immune function. And you have surveillance cells as part of your immune system that are circulating throughout the body. You also have some immune surveillance that happens right in the lymph node. So as the lymphatic fluid, let me go back, is coming up here, it's traveling through these little nodes. And inside the nodes, you can think of these as checkpoints. And if there's an antibody, like a foreign body that enters in there, and the surveillance immune cells that are in that lymph node says, wait a minute, this is something foreign, this doesn't belong here, it might have some antibodies right in there, or it might just get on the phone and say, send the antibodies, we're in this lymph node, get them over here, and those white blood cells travel through the lymphatic system. So it's a very big part in immune surveillance. So it provides surveillance by recognizing and responding to foreign cells, microbes, viruses, cancer cells even, and it circulates lymphocytes and other white blood cells to make them available to fight off bacteria and viruses that are potentially harmful to the human body. The lymphatic system is arguably the most neglected bodily system, and that was from a 2020 research study that was published. Why? Why is it the most neglected body system? Well, it starts early. This is my daughter's science curriculum, and what I talked to you about was the blood leaving the heart in the aorta, which then reduces down in size to the arteries, which then goes into arterioles, passes through the capillary bed to the venules to the vein. And according to this, all of it, 100% goes through. Well, I just told you that's not true. At least 15% and probably more leaks out in the capillary network, and that's where the lymphatic system has to be to pick that up. So it kind of starts early. The lymphatic system is an important part of the cardiovascular system, but they don't learn about it. And maybe it's not a big deal that they're not learning about it in grade 10 biology, but unfortunately, it kind of continues, just ignoring it. And it's easy to ignore because it's not so vibrant and in your face as blood, right? Or the heart. So these systems are equally important in cardiovascular, circulation, but just not so exciting, right? The heart, we can feel it pumping, we notice it. And of course, if you start bleeding, that's very obvious. The cardiovascular system circulates 8,000 liters a day, just around and around and around. The lymphatic system moves about 4 liters a day, but what it's moving is clear or maybe slightly yellow color. The vessels are very tiny, very delicate, and so it just doesn't scream for attention. Here are some other ideas. Well, it's clear or white versus blood, which is red. And I'm not making this up. This is presented at lymphedema conferences, and they do an audit of medical schools and how much time they're spent on the lymphatic system. And apparently it's 15 minutes in medical school versus, hematology is a whole specialty. Lymphedema is a medical condition, blood, there's hemophilia, leukemia, we've all heard of those things. We have lymph nodes and lymphangions as compared to the heart, right? We know the heart gets a lot more attention. Ultimately, the amount of volume of lymph fluid is 4 liters versus blood is 5 liters, and there's different types of lymph. There's lymph and chyle, and they'll talk about that. We just know a lot more about the blood circulation versus the lymph circulation. And, what I sometimes like to share with my clients, if you think of any body system, you think of your skin, okay, there's a medical specialty for that. It's called dermatology. Obviously there's a system, medical specialty for your heart, cardiology, I can't think of another entire system of the body that doesn't have its own medical specialty, but there's not a way for doctors to specialize in the lymphatic system. Okay, let's talk about lymphedema. How does it develop? Well, there's some kind of compromise in the lymphatic system, and it can just be primary lymphedema, which means, when a baby is born, there's a defect in how the lymphatic system formed. However, because we're speaking today with the Canadian Cancer Survivor Network, a lot of people develop lymphedema because that lymphatic system compromise comes about from the cancer treatment, either that the lymph nodes removed or they're radiated or both. Transportation of interstitial fluid to the blood is reduced. So interstitial fluid means the fluid that's surrounding the cells. So as that blood fluid comes through the arterial into the capillary bed and leaks out, that is interstitial fluid. Okay, so transportation of that is reduced. And then lymph stasis develops. So stasis is just like stagnant lymph fluid just hanging out there in that interstitial space. And the one thing that's unique about lymph fluid is that it's protein rich. And so that protein accumulates. It changes the osmotic pressure, and then more fluid is driven into the interstitium, and then lymphedema presents. So in other words, then you notice, oh my gosh, my one arm is bigger than the other, or my one leg is bigger than the other, or one breast is all swollen. How is it treated? It's treated with complete decongestive therapy. And that is a 4-part process. It involves skin care. So for example, you want to keep your skin moisturized, and the things that you apply to your skin, you want it to match the pH of your skin, and that being acidic. So you want to use acidic products like creams and lotions that you're putting on, or soaps and things like that. You want to match the pH. Exercise. Unlike the blood system, which has a central pump, which is the heart, the lymphatic system has these little lymphangions, and they only work if you move your body. And so you want to keep pumping and circulating that lymphatic fluid. Manual lymphatic drainage, that's the proper term for it. So manual meaning by hand, right? Lymphatic drainage. So it's a technique that a massage therapist, a physiotherapist, occupational therapist with special training will do. And I would encourage you to use that term, manual lymphatic drainage, rather than lymphatic massage, because all massage therapists are trained in lymphatic massage, but only professionals that go for additional training are trained in manual lymphatic drainage for lymphedema. Okay, so you want to make sure you're getting to the professional who is properly trained. And then fourthly is compression. And compression has 2 stages. The decongestive phase, which uses something called multi-layer compression bandaging. It's a fairly intensive treatment, but incredibly effective. It will reduce the size of the swollen area. And then once that has been reduced and stable, then you wear a compression garment. So this is something ideally that's custom to you. It's not just off the shelf. It's customized to your measurements, and you wear, you've probably seen people with a compression sleeve or a gauntlet or a glove or compression socks and stockings. There are compression vests. There are compression head pieces for people who have lymphedema in their head and neck, maybe after head and neck cancer, etc. So it's very important you see a certified lymphedema therapist. And because I'm not a certified lymphedema therapist, I'm not going to talk any more about that, but I'm going to get into my role, which is as a registered dietitian. And I will say that our roles are very complementary. And when I receive a new client who has lymphedema, I always make sure they're working with a certified lymphedema therapist, because I find, it's the results they're going to achieve are going to be much better when you have a certified lymphedema therapist and a registered dietitian working together. So let's talk about lymphedema nutrition. And let's begin with salt and water. Salt is not your friend if you have lymphedema, and you need to be aware of how much salt is in your food. Probably the best way to do that is start reading your labels. If you are not using processed food, in other words, a food that doesn't have a label, chances are your salt intake is already fairly low, because the majority of salt in the Canadian diet is from processed, prepared, and restaurant food. So if you're eating very little of that, chances are you're already ahead of the game. And the average Canadian intake of sodium is estimated to be 3,400 milligrams a day. Now, if you have lymphedema, or if you have other swelling conditions, the recommendation is generally to keep it to 2,000 milligrams a day. If you have high blood pressure, then it's 1,500 milligrams a day. So some Canadians are arguably getting double what they should be getting. The one thing that people maybe are afraid of or don't enjoy about reducing the salt intake is they might say the food tastes flat, or it tastes boring, it's got no flavor. A couple things I want to say about that. First of all, add lots of herbs and spices. Basil, oregano, parsley, rosemary, thyme, cayenne pepper, chili flakes, dill, marjoram, paprika, anything you can think of. It will add flavor to your food without swelling your lymphedema. And most importantly, as a cancer survivor, this is very important, the herbs and spices are anti-inflammatory. And that's very important because inflammation is something that cancer cells love. So as a cancer survivor, you're wanting to reduce inflammation. The other thing I wanted to say about, that transition to a lower salt diet is that there is a phase as you implement it in which the food just kind of tastes flat. It doesn't have a lot of life to it, tastes bland. But if you're patient and you persist through that, your palate will adjust. The food is not going to taste like that forever. It takes a couple of weeks, and what you'll notice is you will start to notice the flavors more. And what happens is if you were to go back and eat something that you used to eat, it'll taste very salty and very uncomfortable. So just know that the food is not always going to taste flat if you're not used to eating low sodium. Now, I want to talk to you about how the body actually perceives thirst. And if we go through this chain reaction here, first of all, water is lost from the body, and it could just be not doing anything in particular, just you're breathing, and as you breathe out, there's moisture in there. Obviously, you're going to the washroom, and all of this is accelerated. If it's a hot day and you're sweating more, you're being more active, or if there's vomiting, if there's diarrhea, if there's lymphorrhea, then obviously that gets accelerated, or fever, right? But it can just be regular water loss from the body. Your ionic concentration increases. So what this means is there's certain compounds in your body that have an electrical charge. Some have a positive charge, some have a negative charge. And the ions, I think I have a picture of it in a new slide, but sodium and chloride, which are both minerals, they hang out in the interstitial space, the area around the cell. And what happens, they do have an electrical charge. And what they'll do is they'll pull fluid from inside the cell to that intracellular space. And so that's what this is saying. And then your cells shrink. And when your cells shrink, that sends a message to the brain, and the brain says, oh, cells are shrinking. You have to send a message now to the mouth so that the mouth feels thirsty, and then it triggers you to say, oh, I need to drink some water. But notice, by the time you feel thirsty, your fluid has already shifted into the interstitial space. My advice for people with lymphedema is, see if you can stay ahead of your thirst and not wait until you're thirsty, because you're playing catch up if you're doing that. Some people may have been told if they have cardiac edema or renal edema or liver ascites edema to restrict your fluid intake. But for lymphedema, we do not restrict fluid. And I mentioned earlier that lymphedema is protein rich. The 4 components of complete decongestive therapy, the exercise, the skin care, the manual lymphatic drainage, and the compression, that's all designed to move that lymph fluid out of the limb where it's trapped. So if I have lymphedema in my arm, all of those therapies are designed. We want to keep the skin soft so that the fluid can move out. We want to exercise so that pumping can happen. We want to do manual lymphatic drainage to move it out. We want to do compression. And it's graduated compression. So whenever you wear compression, it'll say something like 20 to 30 millimeters mercury. So what that means is 30 millimeters mercury here, 20 millimeters mercury here, so that it's designed to make the fluid go up the arm. Same if you had a leg compression. Most of the compression is here, less here, so it's graduated compression. It's forcing that fluid up. Now, with diet and nutrition, we want to complement that. So if you were to get dehydrated, the protein that gets left behind, and then it gets harder to move the fluid out because the protein is too concentrated. So that's why with lymphedema, we say do not restrict your fluid. In fact, you want to even try and stay ahead of your thirst. It's counterintuitive a little bit because you think, I have this swollen arm, I should drink less, right? That to me is what would make sense. But if you understand that it's protein rich and you're making it harder to move the fluid out, that's when you understand, okay, I need to drink. Let's talk about the next strategy, which is anti-inflammatory. I mentioned, think of this car here as the protein, and think of this water in this flood as the lymphatic fluid. That protein, it's like a beacon. It sends out a signal to the body that says, send the inflammatory cells. So along come the macrophages and the other inflammatory cells. And so what happens in that environment where you have lymph stasis, it's a very inflammatory environment. And unfortunately, that can lead to some of the downstream progressive worsening of lymphedema. So with inflammation, both experimental and clinical studies spanning several decades have implicated inflammation as a critical component in the pathophysiology of lymphedema. So even if your lymphedema didn't look red, we know what's going on underneath the skin is that stagnant pooling of lymph proteins, and those proteins are sending out that beacon to call the inflammatory cells. Let's look at this diagram. So we have impaired lymphatic drainage, and because there's impaired lymphatic drainage, there's inflammation. We know now why the inflammation is there, because it's that lymph stasis. And unfortunately, the inflammation is a backwards arrow going back to impaired lymphatic drainage. So these two are feeding off each other, making it worse. Inflammation leads to fibrosis. And unfortunately, with lymphedema, it is a chronic condition, but it's also progressive. Now, what is progressive about lymphedema is that over time, instead of just having a soft skin and, sort of squishy fluid filled, over time, it becomes fibrotic. And what that means is it becomes harder, the skin becomes thicker, and eventually to the point where there's not fluid left there anymore. So those techniques of manual lymphatic drainage and compression, there's no fluid left because all that fluid tissue is gone and it becomes fibrotic tissue. Because when that protein is stagnant there and it sends out the beacon and says, send inflammatory cells, those inflammatory cells, and they get to work. And what they start to do is build a fibrotic fatty scaffold, and they start to thicken the skin. So over time, those changes happen in your lymphedema. And so that's what's meant here by fibrosis. It's a buildup of that fibrotic skin here, which they have a separate issue, but adipose tissue deposition and remodeling, right? So we're making this fibrotic fatty scaffold under the skin. A lot of double arrows here. So the fibrosis, of course, impairs your lymphatic drainage even more. And then that creates more fibrosis. This adipose tissue deposition, so more fat tissues lay down, and that leads to more impaired lymphatic drainage. It just really seems like an impossible scenario of all these double arrows. How do we get out of this? Well, there has been research looking at anti-inflammatory medications, and that research is ongoing. We don't really have a clear winner in that regard, but there are clinical trials underway. But as a dietitian, I look at this and I say, I know how to reduce inflammation. There's a whole diet protocol demonstrating that it can reduce inflammation. And it's the anti-inflammatory diet. What is the anti-inflammatory diet? Well, it's a diet that's low in sugar. And by that, I mean added sugar. It has unprocessed whole foods. It's high in fiber and it's low glycemic. A lot of these things kind of saying the same thing, these first four, because technically if something is unprocessed whole food, it tends to be high in fiber and also low glycemic. But the studies measure each of these components differently, so that's why they seem kind of synonymous, but they're slightly different. But they're all very complementary. Rich in vitamins, especially B6, B12, folate, vitamin K, and antioxidants. Low in trans fats and saturated fats. Trans fats, we don't have too many of those left in the Canadian food supply because Health Canada said, no, they're illegal. We're not putting those into the food supply anymore. Now, you may still get trans fats if you're eating oils cooked at high temperature or oil that's been reused, which typically I would think is more from restaurant, not from what you're doing at home. So it has to be low in trans and saturated fats. Saturated starts with an S and so does solid. So a saturated fat is a fat that's solid at room temperature. So if you buy a pound of butter at the supermarket, you put it out on your kitchen counter when you get home and let it sit until it's room temperature, it doesn't melt into a puddle, right? It stays in that rectangle shape. So even at room temperature, it's solid. Same thing if you take a steak, put it out on the kitchen counter, you're going to marinate it. The fat that's on that steak, it doesn't melt. It's solid at room temperature. Coconut oil, take that out of the jar. It's that white globular looking stuff, solid at room temperature. Those are all examples of saturated fats, all right? So you want a diet that's low in saturated fat. You want a diet that's high in omega-3 and omega-9. Omega-3, obviously, people are going to think right away, salmon, right? Salmon, sardines, herring, rainbow trout, mackerel, anchovies, those are all omega-3 rich fishes. In addition, walnuts, flaxseed also have omega-3. Omega-9 fatty acid, that's your olive oil, avocado oil. Another omega-3 is canola oil. High in anti-inflammatory phytonutrients. So I mentioned earlier when we talk about salt that, you know, if you take salt out of your diet and you find the food tastes bland, to add herbs and spices. And not only will they add flavor, they are anti-inflammatory. And what does it look like if you put this all together? It's a whole food plant-based diet or a traditional Mediterranean diet. And I'll show you a picture of that. But notice I didn't say vegetarian diet. And we don't tend to use that term because vegetarian is talking about what's not in the diet, which is animal products. But I've had many young women come to see me. There are vegetarians, and what are they eating? French fries and a Coke, right? Technically, that's vegetarian. But really, to be anti-inflammatory, we want it to be whole foods, so not processed, plant-based, which means a lot of plants on the plate. It doesn't have to be exclusively plants, or the traditional Mediterranean diet, and I'll show you that in a second. On the flip side, here are things that are inflammatory that you want to limit. Added sugars, processed foods, foods that are low fiber, high glycemic, empty calories. High glycemic means a food that after you eat it and it breaks down to sugar, it's going to raise the blood sugar quickly. Okay, so it tends to be foods that are highly processed, low in fiber. Empty calories, foods that are high in trans fat, saturated fat, and cholesterol, high in omega-6. Now, it's not that omega-6 is pro-inflammatory in and of itself. It's actually mildly anti-inflammatory, but you want to have the right ratio. So you want high omega-3, omega-9, and probably you can't get rid of all the omega-6 in your diet, but just to improve the ratio there. A diet that has hardly any herbs and spices would be pro-inflammatory, and sort of the typical Western diet. There's lots of misconceptions about the anti-inflammatory diet, especially if you're on social media. One thing I see all the time is, oh, you have to avoid dairy if you want to be anti-inflammatory. No. This study shows that the consumption of milk or dairy products did not show a pro-inflammatory effect in healthy subjects or individuals who are obese or overweight or had other metabolic abnormalities. Now, having said that, that's not a green light to eat as much cheese, cream, and ice cream as you want, right? Because those contain more saturated fat. If you read your labels and you look at your package of cheese, it has 32% milk fat. Cream, full cream, 35% milk fat. Ice cream, I don't know, probably similar, right? However, milk, yogurt, cottage cheese, those are all fine. So you don't have to omit all dairy products, but you do have to choose the lower fat ones. And I think the best one really is yogurt, because you get that probiotic bacteria, especially if you're actually reading the label and choosing a yogurt that says probiotic right on it. And of course, unsweetened would be best. This is another myth that's out there, that you have to be gluten-free or wheat-free in order to be anti-inflammatory. And that's not the case. Higher whole grain intake was associated with lower HSCRP. What is HSCRP? That stands for high sensitivity C-reactive protein. It's a blood test. And that blood test, it tells you how much inflammation. The other one is just straight CRP. You may have access to your own blood work and can look and see on your blood test, have you had a CRP blood test? If not, you could always ask your family doctor or your oncologist, if they would test that for you. So C-reactive protein is one of a few different blood tests. It's the most common one to measure inflammation. And we do have evidence from many studies that changing your diet to become an anti-inflammatory diet does lower your blood levels of inflammation. Okay, that's been validated many times over. So if you did see a high CRP, the research tells us you can lower that by changing your diet. So whole grains are not a problem, and refined grain intake is associated with a higher concentration of CRP after adjustment for lifestyle and dietary factors. And unfortunately, sometimes people want to go wheat-free or gluten-free, and they end up buying a lot of processed foods that are based on, rice starch or potato starch. Now, you could certainly be gluten-free and consuming quinoa or buckwheat or amaranth. There's a lot of other whole grain elements that are out there that you don't have to go to the full-on processed foods. Is gluten-free diet recommended for cancer or lymphedema? There's no evidence. The only thing I would say about this is if you have celiac disease and consuming gluten, then absolutely that's going to create some inflammation, and that's going to be problematic. And what I would suggest, if you're kind of thinking, oh, I wonder if I have celiac because every time I eat bread or pizza or pasta, I get bloated and I just feel uncomfortable. You might think, oh, I might try gluten-free diet. No, don't do that. If you suspect you have celiac disease, keep gluten in your diet. Go to your doctor, say, I think I have celiac disease. These are my symptoms. Can you please test me? And the test you want is the tissue transglutamase IgA test. And what this is looking for are your antibodies against gluten. And that's why I say don't take gluten out of your diet. Because if you take gluten out of your diet, then do the blood test, you will get a false negative. because you're not going to produce antibodies against something you're not consuming. All right. Now, if you're consuming gluten and you go for this test and it's negative, then sure. If you want to try gluten-free, go ahead and see if you feel better. If that blood test is positive, then you're going to be referred to a gastroenterologist for an endoscopy, because they're going to want to put a camera down into your small intestine and have a look down there, take some biopsy samples. All right. But it's important not to do this, despite what you might hear on social media, which says, oh, to go gluten-free if you've had cancer, if you have lymphedema. That's not evidence-based. Let's talk about fat absorption. Now, this Italian physician, Gaspare Azelli, was the first to discover the lacteals, and that happened in 1622. This ranks among the most important physiological discoveries of the 20th, what is that? My Roman numeral, the 17th century. There we go, 17th century. All right, so let's look at this. So let's say you're going to chew up your food, swallow it, go down the esophagus, into the stomach, then from the stomach into the intestine, and that's where the intestines really break the food down into its smallest components. And as I mentioned earlier, fats and oils get broken down into fatty acids. And fatty acids are chains of carbons. You've got carbon, 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 carbon. You've got hydrogen bonds attached. You've got different endings on these because there's different fatty acids, right? Some of these carbons have, or some of these fatty acids have 6 carbons in the chain, which is known as short chain. Some have 12, which is known as medium chain, and some are longer than 12, which is known as long chain fatty acid. So after you eat the food, the body breaks it down into fatty acids. If there are short or medium chain fatty acids, they get absorbed directly from the small intestine into the portal vein. They're now in the bloodstream, so they're technically absorbed by the body. Long chain fatty acids are not soluble enough to be absorbed there. So they get put into a chylomicron, which is a fat transporter sphere. Whenever I say transporter, I always think of Star Trek. Get ready to transport, right? So it gets into this chylomicron, and then it makes its way to the lining of the small intestine, right? And if you've ever seen images of the small intestine, it's full of villi. So villi are these finger-like projections. Now your small intestine is about 16 feet long, but it's all jumbled up in there. And the reason is that it's sort of this accordion shape. It's got all these up and down villi. And as that chylomicron approaches the villi and goes through, because there are cells that are like this, there's space in between, and it gets absorbed into a lacteal. And a lacteal is a single lymphatic capillary. And those lacteals are all joined up. They're all a network, so that chylomicron goes in there into the lacteal. The lacteals are all joined up. They work their way all through the lymphatic capillary network and the lymph nodes that are in the intestine up to this depot here called the cisterna chyli, up the central lymphatic trunks and get absorbed up here by your neck. Okay, so that's how fats get into the bloodstream, go all the way up to the, and then absorbed by the neck. And it's absorbing long chain fatty acids or triglycerides, cholesterol, fat-soluble vitamins like A, D, E, and K. That's all transported through the lymphatic system. So your gut health is very important. Now, not only are there lacteals, but there are these villi, and there is your microbiota. These are the 3 main structures of your gut lymphatics. And your lacteals are just kind of floating around, right? They're just kind of hanging out. They have no propulsion ability. In fact, how do you get that lymphatic fluid through the lacteal is that the villi have a propulsion mechanism. They can move that fluid through the lacteals. The lacteals, so they have no propulsion and they can just be sloughed off. So just think about, you brush your hair, some of your hair falls out, or you do this to your skin, some of your skin cells come off. Your lacteals are like that too. So we need to grow new lacteals. How do we grow new lacteals and keep a healthy population of lacteals? Well, your villi secrete something called VEGF-C, which stands for vascular endothelial growth factor. It's what forms your lymphatic system in utero when, you know, you're a fetus and the body systems are all coming together. It's VEGF-C that says, okay, we need to form a lymphatic system. And how do the villi know when to secrete VEGF-C? The microbiota tells it to. So in order to have a healthy lymphatic system, a healthy gut, you need healthy villi, you need healthy microbiota, and you need healthy lacteals. And what can happen sometimes is people who have lymphedema can develop gut issues. And then the gut issues, and let me just say this, we know from animal studies that lymphedema in of itself can develop what's called gut dysbiosis. So you know, the amount or the types of microbiota is sort of off, the VEGF-C is not being secreted like it should, you don't have a good population of lacteals. So, and then stuff starts leaking in the gut, right? And that can affect lymphedema. We also know from human studies that just people who have obesity can have gut dysbiosis. So your gut health is actually very important for your lymphedema. I already basically said all of this. This is chyle. This is what it looks like. And it's kind of this milky white material. So when Gaspare Azili in the 1600s discovered these vessels, he called them lacteals. Now, what does that word lacteal remind you of? If you know French or Latin or Italian, lac is milk, right? So it's this milky white substance. So that's why they were called lacteals. So chyle is a mixture of the milky white substance, which is actually your fats and your chylomicrons mixed with your normal lymphatic fluid, like that more plasma type stuff, okay? I want to tell you about this study. So this was a study of breast cancer survivors, and they were all overweight, and they all had lymphedema. So what they did was they calculated what they normally eat, and then they said, okay, we're going to subtract between 500 and 1,000 calories from what you normally eat to help you lose weight. We're going to teach you how to do a nice anti-inflammatory Mediterranean type diet. Half of you are going to get a placebo pill, and the other half are going to get a symbiotic supplement. And a symbiotic is a combination of a prebiotic and a probiotic. I'm going to show you a little bit more about what exactly that is. And then they followed them for 12 weeks, and they wanted to know what happened with the lymphedema, what happened with their weight, what happened with their inflammatory blood levels. And what they found was the ones who took the symbiotic supplement had reduced their lymphedema more. And significantly compared to baseline and more than the placebo. They also reduced their inflammatory markers more and their weight more. So it really showed this idea that these overweight women with lymphedema, who animal and human research tells us probably have gut dysbiosis, that they were able to lose more weight, more lymphedema, and more inflammation if we paid attention to the gut health. So a symbiotic is a combination of a prebiotic and a probiotic. Let's start on this side. Probiotic is live bacteria, healthy bacteria. And yogurt, kefir, those are good examples. Now, you might also be thinking of, well, kimchi and sauerkraut and sourdough bread. Well, all of those are made from fermentation. And to be clear, all probiotics are from fermented foods, but not all fermented foods are probiotic, because by definition, a probiotic has to be live bacteria that's present in a large enough quantity that survives the stomach acid and that gets into the intestine in a large enough quantity to provide a health benefit. So if you are buying a bottle of sauerkraut at the supermarket and that has been pasteurized, it might not have live bacteria left in it. If you're making your own sauerkraut, probably that's probiotic. If you ever notice, if you go to the dairy case and you look at all the yogurts, some of the yogurts say probiotic on the label and some do not, even the same brand. The one that says probiotic is more likely to have, meet that criteria, have a large enough supply of good bacteria by the end of the expiry date that's going to survive the stomach acid and get into the intestine and provide a health benefit. So be careful when you're reading your labels. Prebiotics are fibers. Now, while all prebiotics are fibers, not all fibers are prebiotic. And what I mean by that is a prebiotic fiber has to, again, get into the intestine, kind of survive digestion enough to get into the intestine and provide a health benefit to your live bacteria that live in your intestine, to your microbiota. So a synbiotic is a supplement that has both. So it has the live bacteria, so it'll say something like Lactobacillus acidophilus, Lactobacillus breve, something like that. And a prebiotic, you might see inulin, or you might see fructooligosaccharides or galactooligosaccharides. And these sound sort of like chemical sounding names, but it's just a naturally occurring fruit sugar. Okay, it's a type of fiber. All right. And if you have both of those together in the supplement, and if you're curious what was actually in the supplement, I do have a blog on this on my website if you want to go and read. I talked about exactly which bacteria are in there. Let's talk about fasting. Now, there is not a study of people with lymphedema and intermittent fasting. But because I've read a lot of studies around intermittent fasting, this is more my hypothesis, and I have tested this out. All right. Now, 7 reasons why I think intermittent fasting has been good for lymphedema. And I certainly see this in my clinical practice. So when reading the intermittent fasting studies, we know that it's anti-inflammatory, meaning that it lowers those blood levels of inflammation, that there is weight loss. Now, when they compare weight loss due to intermittent fasting versus traditional calorie restriction, the weight loss is about the same. So it's not crazy, blowing it out of the water. It's comparable. All right. Muscle maintenance. So if you are thinking, oh, if I do intermittent fasting, I'm going to lose all my muscle. Well, the research shows as long as you keep working that muscle, you don't lose any more muscle with intermittent fasting than with traditional. Bowel rest. Here's something that this is where I first made the connection between lymphedema and intermittent fasting. Thinking back to my days when I did my training, I did a clinical dietetic internship at a teaching hospital. And on the GI unit, what we would do if we got someone admitted and their Crohn's disease or their colitis was in a total flare-up and everything was just going through them, one of the therapies we would do is called complete bowel rest, where we would not feed them at all by mouth. Instead, they got all their nutrients through their vein. And with all of the lacteals and lymph nodes and lymphatic capillaries that are in that intestines, it started me thinking, what if we rested that? Because we know that more than 50% of the lymphatic fluid that's formed in your body comes from your digestive tract. And every time you eat, there's an increase in lymphatic fluid. So I started thinking, why don't we give the body a chance to sort of clear that? And that's really what started me on that pathway. Improve microbiota, reduce blood pressure, reduce cholesterol. And I can get more into, if people have questions about how that's related to lymphedema. But for now, you can just take my word for it. So in addition to sort of this hypothesis that I have, I also know intermittent fasting is safe, and I've used it with my clients. So this recommendation is more anecdotal than evidence-based, or at least it's not evidence-based on people with lymphedema. And I'm not talking anything crazy here. What I recommend initially is 12 hours of intermittent fasting. And then once they get to that, then 13 hours of intermittent fasting. And then people might decide, oh, I can do 14 hours, right? Nothing crazy, but just giving that basically what it means is after dinner, don't eat again until the next morning. All right. Don't be snacking at night before bed. And also, as an aside, we have breast cancer and prostate cancer studies in survivors that show, well, the breast cancer study showed that women who fasted 13 hours a night had lower risk of recurrence. And there was a breast and prostate study done in Spain. And I don't know if you know much about Spain, but their lifestyle is to eat dinner very late at night. And so this study found if they ate their dinner by 9 p.m. instead of 10 p.m., and they had at least 2 hours between finishing the meal and going to bed, they had lower risk of recurrence. So I really do think that longer overnight fast is better. Let's talk about protein. As I mentioned, the heart is what's going to pump the blood. The lymphatic system has these lymphangions, these little pumps, and the way to activate those little pumps is to use your muscle. Unfortunately, what happens on the other side of that is we're all fighting something called sarcopenia, which is the age-related decline in muscle strength, muscle mass, and performance. And sometimes cancer treatments can accelerate that sarcopenia, especially GI-type cancers. How do you combat sarcopenia? You got to eat the protein and you got to use your muscles. There's no other way around it, right? So making sure you're getting enough protein, you need to be eating protein at every meal and then using your muscles. And if it's not dumbbells, then it can be bands or, you know, just using your own body weight, doing push-ups or planks or things like that. And you know, work with a physical therapist or a personal trainer if you're not sure how to get started with that. In summary, here's my plan for lymphedema, and I didn't have a chance to go through everything here, but anti-inflammatory, low salt, lots of water, low fat, time-restricted eating, rich in probiotics, high in fiber, and sufficient protein. All right, if that feels too much, break it down into baby steps. Complementary therapies are also out there for lymphedema. I have more information about that in my book and website if you want. This is the book on complementary therapies. If you have lymphedema, this is an excellent resource. And if you're going through cancer treatment, another good resource there. All right, I also have blog. You can go read that. I don't know if there's any time for questions or if I took up too much time. I'll hand it back to you, Trevor.
Absolutely, and we have tons of time for questions. Thank you so much for Jean for that. It was a fantastic presentation. Our first question comes from Natalie. What are some examples of fats or oils that are high in omega-6?
So the omega-6 ones would be corn oil, soybean oil, grapeseed oil. Those are the main ones. Yeah, thankfully in Canada, we grow a lot of canola. And canola oil is very common here. And it's the highest in omega-3 that you can cook with. There's two higher, flax oil and hemp oil. You can't cook with those, but if you wanted to make a salad dressing with those, you could do that. Yeah, so I find here, if you read your labels, like your salad dressing and your mayonnaise, it tends to be more canola just because we're in Canada. But you know, if it's soybean or corn, you might want to look at a different brand.
All right, excellent. My question is, with the increase of people talking about nutrition through social media and other places, has it made your job easier or harder as a nutritionist, especially for lymphedema?
I'm not sure how to answer that because I guess correcting the information, it just gives me lots of content, right? So if I hear people talking all the time about, like, speaking of oils, all these social media influencers are like, no seed oils are inflammatory. Well, that's not true. Canola is a seed. Canola is very anti-inflammatory. Flax is a seed. It's very anti-inflammatory. And it's not even that soybean, which I get is a bean, not a seed, really inflammatory. It's just that it's not as anti-inflammatory as the others. So it gives me lots of great content. But I feel bad for consumers, honestly, because it can perpetuate a lot of misinformation, especially what happens, I find, is it just gets repeated and repeated and repeated. Somebody says it, somebody says seed oils are inflammatory, so somebody else repeats it. No one actually does the work to fact check. And as the consumer, you hear it 15, 20 times, you think this is a fact. Seed oils are inflammatory, I can't have seed oils. That's not a thing, right? So I feel bad for people who don't know any better, and then they get roped into that, especially with like they do gluten-free. Well, that actually could be doing some harm, or they do some other things where there's harm done, right? I feel bad about that.
Excellent. Thank you very much for that answer. We have time for one more question. I think because we were talking about protein, that's important. Barbara asks, how much protein per day?
Right. So as a general rule of thumb, you want to go 20 grams per meal. However, if you really want to customize it and figure it out for yourself, it's based on your body weight. And I only know this in kilos, but the very absolute lowest you would want to do is 0.86 grams of protein per kilogram body weight. So do a little bit of math, 0.86 times your weight in kilos, whatever that equals, that's the absolute lowest you'd want to have. But more realistically, you want 1 gram per kilo. So whatever you weigh, if you weigh 70 kilos, you want 70 grams of protein. If you are being a little bit more active, maybe you're doing some weight training, things like that, 1.2 grams per kilo. If you're currently going through chemotherapy, if you have a wound, if you're doing more intensive, weight training or more regularly, then 1.5 grams per kilo. So you can customize it beyond just the general if you want to do a little bit of math for yourself.
All right, wonderful. Thank you for that. Jean, it was fantastic having you on. A very important discussion, and I hope that we can see you again soon, either another webinar or a podcast. So thank you very much for your presentation.
You're welcome. My pleasure.
And just a reminder that we do have webinars coming up later in the season, so keep an eye on your email if you've subscribed to our newsletter. If you haven't, you can do that on our website, survivornet.ca/newsletter. And if you want to check out our other webinars, just go down to survivornet.ca/webinar or search CCSN in YouTube. And with that, hope everyone has a good day, and we'll see you on the next one.